Welcome, everybody. My name is Patrick Kolowitz. I'm the Director for Mental Health and Addictions here at Hotel de Grace Healthcare. And welcome to the second day of the inaugural Caring for the Caregiver Conference. Last Saturday, we had an eventful day. We provided an overview of findings from the Caring for the Caregiver study. We also learned about consent in the Mental Health Act, as well as mental health and addiction management. And we listened to a panel of caregivers who shared their experiences, and that was John and Cleo, Lucille and Cindy. Today, we will continue our focus here on education, connections, and wellness. We will learn about compassion fatigue, access to care, and navigating the healthcare system as it relates to mental health and addictions in Windsor, Essex, and as well learn about privacy and consent. We have also incorporated opportunities for you as caregivers to connect with fellow caregivers in private small group breakout rooms. And just to note that the session recordings from both days, with the exception of the panel discussion and the peer support groups, will be made available on the WeSpark website. And so more details will be emailed following this second day of the conference. And next slide. So before we begin, we'd like to do our land acknowledgement, and we would like to acknowledge, and I'm just going to move my thing here because the Zoom thing is in the middle of it. We would like to acknowledge the traditional, ancestral, unceded territory of the Three Fires Confederacy of the First Nations, comprised of the Ojibwe, the Ottawa, and the Potawatomi. It is the territory on which Hotel de Grace Healthcare, the University of Windsor, and the WeSpark Institute sits. And as settlers, we are grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. We want to thank again our organizing committee. There was a ton of work that really started 2 years ago, leading up to this two-day conference. So thank you from those that are attached to Hotel de Grace Healthcare, the University of Windsor, and again, the WeSpark Health Institute, and all the student volunteers as well. So much appreciated to our organizing committee. Next slide. And also we want to thank our session facilitators. Some of these facilitators were last week. So we heard from Angie Hamilton and Mary J. Dykeman. And then we also heard from Dr. Ashan Virakamur, Dr. Dr. Sean Prabhu, and Dr. Zinnia Ali. Today we'll hear from more presenters, including Colleen Bruner-Peltier, Dr. Anne McLaughlin will be presenting, and Judy Lear-Zelstra and Patricia Thomas, sort of jumping around here, but they'll be co-presenting with one another, and also John Clark will be presenting. Thanks again to also Dr. Cruz and Dr. Jen Voth and Clemenza for facilitating sessions as well. So thanks to everyone that, again, was involved in not only the first day, but the second day here as well. Next slide. And again, thanks to all of our sponsors at the WeSpark Health Institute, the University of Windsor, and the Hotel de Grace Healthcare Foundation for making a lot of the prizes and giveaways possible. Also, a lot of the communications that went into the event and leading up to the event here today. So the next set of the presentation, it's my pleasure to introduce Janice Kaffer. I've been fortunate to have been mentored and influenced by Jan for over 10 years. Just a bit about Jan, sort of going off script here. But for those who know her, they would describe her as being proactive, a forward thinker, innovative, resilient, especially in the light of COVID. That COVID definitely tested the resiliency of all the leadership locally. Firsthand, I know that Jan works really full tilt and tirelessly. And again, even more so in light of COVID. But her overall intention or goal is to transform lives and cultivate a healthier community here in Windsor, Essex. And when I describe community, I really mean across the lifespan. So that stems from youth all the way to older adults and across the different domains of health. And all of us here know this most, that we have both physical health and mental health, and you can't separate the two. They're interconnected. One influences the other, and they're definitely, obviously, both very important to focus on. And we appreciate this relationship between physical and mental health, and as well outside of the across the age continuum and the focus of from youth to older adults, and as well that focus on mental health and physical health. Jan also focuses on all the vulnerable and in the marginalized groups in between that continuum. And so Jan actually was in the news earlier this week, and there was a large announcement from Doug Ford, the Honorable Christine Elliott, our health minister, and also Michael Tobolo, our Deputy Health Minister of Mental Health and Addictions, and David Mouget was there as well from Windsor Regional. And this is some very exciting news. It's actually sort of a two-part announcement, and a bit sorry to put Jan on the spot, but I was hoping she could perhaps, in addition to welcoming the caregiver group, speak to this exciting news and how she sees it improving the experience or benefiting our community, including the caregivers. So with that said, I'll lead it over to Jan for welcomes. Thanks, everyone.
Thank you so much, Patrick. I appreciate the very kind welcome, and I very much appreciate the opportunity to be here with a group of individuals that are so essential to our patients, our population that we serve in our community. I've been very fortunate to have been the CEO at Hotel de Grace now for a little over 7 years, and I am coming up on my 10-year anniversary with the organization, having come to Windsor in 2012 as the Chief Nursing Executive at Hotel de Grace Hospital before realignment of services. And back then, Hotel de Grace Hospital had acute mental health services, and we had started some work and we're doing some really good work in the community. But in 2013, there was an opportunity for the hospitals to realign services, and it still confuses our community in Windsor, Essex to this day, who does what and where. I had an email this week actually from someone who thought that David was in charge of the mental health services and up on Prince Road. So that happens still on a regular basis. And the reason I mention that is because when we had the opportunity to move from Willette campus to the Prince Road and take over tertiary mental health services, it gave us the opportunity to start to envision a continuum of mental health and addictions very differently than we had before. You know, we had not had responsibility for some of the longer term mental health services, and in some ways, like acute care hospitals generally are, acute mental health services is episodic and sometimes not necessarily well connected into all the other things that needs to be happening in a community to be able to keep someone well. And so when we moved over to Hotel de Grace Healthcare on Prince Road and took over the tertiary mental health and really started to consolidate a vision for community and hospital-based mental health services that would be integrated and coordinated, and you would have an opportunity to go through one door or two doors versus 25 doors to find help when you need it. That's when a concept called a Center of Excellence started to take root in our leadership and at our board. And the idea of a Center of Excellence is really some of what you're doing here and what you did last week. It's about education. It's about understanding. It's about knowledge. It's about destigmatizing mental illness and addictions. It's about an opportunity to create a system where someone knows how to get help, when to get help, what the kind of help is that they need, and they don't have to wait a long time to find it. And that notion of a Center of Excellence is what the Premier endorsed this past week. And so what's going to happen over the next few years is Hotel de Grace Healthcare will be taking on all of the acute mental health services that are currently at Windsor Regional Hospital. So all of the hospital-based mental health and addiction services will come under the leadership of Hotel de Grace Healthcare, which means there'll be one leadership philosophy, one approach to mental wellness, which is a recovery-based approach that Hotel de Grace Healthcare has adopted. There will be opportunities for us to provide a much more seamless transition for individuals between different aspects of the hospital-based programming. And as many of you know, we also have an integration arrangement with CMHA, Canadian Mental Health Association, which allows for a considerable improvement over the past 5 to 7 years in services between the hospital and our largest community provider. The promise of a Center of Excellence for Mental Health and Addictions is not just about that integration, though. It's also about being able to bring new funding to our community. This is the first Center of Excellence that's been announced by the province in more than 2 decades. Centers of Excellence for Mental Health and Wellness absolutely are seen by government as key providers of care. It allows us to be able to build a hub and spoke model where the center can support all of the outer peripheral agencies like primary care and different smaller agencies that provide some aspects of mental health services. And it also allows us as a community to create a vision for mental wellness that's inclusive of all parts of the continuum. So in my mind, it's a game-changing announcement, and we've been working on it for 7 years. Quite frankly, I was floored that they were announcing it, and I was over the moon excited about it. It doesn't get the same carriage in the news as the new acute care hospital news does, but you guys are used to that. Mental illness and addictions, mental wellness rarely is a headline unless something bad has happened. And when something good happens, it's not very often that the media takes notice. So, you know, we're not surprised by that. So that vision is not just mine. I'm grateful to Patrick for very kind words, but we are very fortunate at Hotel de Grace to have built an amazing team of individuals who all get it, who get where we're trying to go, what we're trying to do in our community. And that's comprehensive, it's inclusive, it's coordinated, and it really is built around the idea that every person, no matter their circumstances, has worth and dignity. And that basic premise is part of our mission at Hotel de Grace. So with that intro, I will also say that I am and have been a caregiver in the past. My mom lived with mental illness, severe depression, and was medicated her entire adult life. I was a crappy caregiver, though. Part of the reason I was a crappy caregiver is because I didn't know enough about mental illness at the time. I didn't know the questions to ask. I didn't know the people to take my mom to for care. I didn't know how to navigate the system, even though at the time I was a nurse and I was a grown-up woman who should have known. And so I commend each and every one of you for being at this conference on a Saturday and last Saturday and taking the time to learn, to connect, to become better at what you're doing that is so essential to the system. So thank you very much. And anybody who has any questions, I'll hang around for a bit, and then I'm going to sign off and bake some bread, which is all about my own mental wellness today. Thank you.
Thanks so much for that, Jan, for that always with grace, the comprehensive overview of some of the changes, your personal experience, sharing your personal experience as a caregiver, and overall for your ongoing commitment to Windsor Essex and your ongoing leadership locally. We all thank you for that. And I saw many comments while you were talking, saying great news around the announcements, and also some thanks for being honest and open with this group of caregivers. So thanks again, and thanks for hanging on for any questions. And on behalf of the organizing committee, we thank you for your participation here today, and we hope you have a wonderful day and afternoon.